we've seen an explosion of AI and AI-driven tools trying to help the field of medicine and especially oncology, because there's a lot of data that has to be assimilated and a lot of data that has to be analyzed. And it's clearly benefits us as clinicians to lean on machine learning and AI algorithms. I was fortunate enough to be part of the team that presented this data at the EAU. And as you can see from the presentation, clearly using AI adds incremental benefit when it comes to risk stratification, putting patients in the appropriate buckets of treatment decision making. It's not the only tool. So far, this seems to be the best tool that at least I've been fortunate to have been part of. But there are other tools that use AI, machine learning, and it's not just based on clinical parameters such as this one, but some of them actually look at tissue-based parameters, look at immunohistochemistry, look at other markers that are available. I think one of the things that we have to be optimistic about is where this will take us, but we also need to be a little cautious, because sometimes what happens is when you have such fine level of detail that AI can help us identify, there's also a lot of noise that's come with it. And we don't want to risk being paralyzed by having so much information at our hands that we lose the science and the art of actually taking care of human beings. And I fear that if this gets incorporated into EHRs or treatment algorithms without the appropriate clinical judgment, we might end up becoming algorithm-based clinicians, which clearly is not something that would benefit patients, because the human element is still very important. An AI tool will never be able to replace me asking a patient, hey, what's important for you? Are you looking for a quality of life? Are you looking for a number of years? That conversation still needs to happen at a human level.